Okay, in this recording, what we're going to do is we're going to look at how you can clinically test the function of your different extraocular eye muscles. Right? So we're going to start off with the slightly more complicated few extraocular eye muscles, and then we'll move on to the more straightforward and easy to understand ones. All right. So the first two that we're going to look at are your superior rectus and your inferior oblique, and your superior oblique and your inferior rectus, right? So just for orientation here, if we look just for orientation, what we have on the left side, this is going to be left side of the patient. This is going to be right side of the patient, so left eye, right eye. What we have here is we have the superior rectus muscle, and then kind of shown through the eye down here, this is going to be our inferior oblique, all right? On the left side, this is going to be our superior oblique, and this is going to be our inferior rectus, all right? So that's just a little bit of orientation, and again, this is, if you need some extra orientation, this is the nose in the midline, something like that, okay? So if we look here, what we can see is you have two muscles, and again, both of these muscles are going to be on both eyes, but I've just removed them just to show one set on one eye and one set on the other, just for to make it a bit more simple and straightforward. Okay, so what we need to do is we need to understand what these muscles do, and then we need to learn how to isolate the muscles from each other. So the reason I have superior rectus and inferior oblique together on this right side is because both of these cause the eye to look up. Right? They both cause elevation of the eye to some degree. The reason I have superior oblique and inferior rectus on this left side is because they both cause the eye to look down to some degree. Right? So you have to learn how to, and you have to understand how to isolate one of these muscles from the other, so that when you have the patient look up, you know that you're testing the superior rectus or the inferior oblique, and whenever they look down, you know you're testing the superior oblique or the inferior rectus. Okay? Otherwise, you don't know which one you are testing. All right. So what you have to do is you have to look at a couple of different planes. Okay. And what I mean by planes is I mean the orientation and the directionality of muscles and also of your gaze. All right. So if we look here, this, and I'm going to do this in a dotted line here, but coming straight out. So this is where our pupil would be, kind of in this region here. Right. Our eye in this case is looking in this straight direction, okay? We're looking in this plane here. Same thing on this side. We are looking straight, and we're looking out that way, okay? So that's one plane. That's one plane of orientation, right? We're looking that way. You also have another one that's going to be for your muscles, right? So if we start just on the right side, you have one plane here for superior rectus, and it's kind of in this diagonal plane, right? And then if we do a different color for our inferior rectus, it's going to be something like this. And then if we come through the other side, it's going to be coming out on this side. Okay, that's not exactly even, but it's going to be something like that, right? So you notice that you have a couple of different planes. You have the plane of your vision, so eyesight. You have a plane of direction of that the muscle is going to pull for the superior rectus, and you have one for the inferior rectus. You should have the same thing on the left side, but we're not there yet. All right. So whenever you want to test these muscles, to isolate just one muscle, so to isolate the superior rectus, so you're just contracting the superior rectus, what you have to do is you have to align the gaze, so your plane of sight, right, how you are looking, you have to make that parallel to the plane that muscle is going to pull. Right. So in other words, if we kind of over-exaggerate this here, right, and I'm going to do this in yellow, but if we over-exaggerate this, you can see that this is the plane of vision, and this is the plane of the muscle. You see how those are not perfectly parallel to one another, right? There's a slight angle. So what you need to do is we need to make this somewhat more parallel, right? So what you can do is you can take the eye and you just rotate it out, right? So you rotate the eye outward. So now that blue line has moved to being something like this. So now our eye is looking out this way in the same plane as the superior rectus muscle, right? And then in this case, for the superior rectus, you would have the patient look up, okay? So you'd have to move the eye out. You would have to abduct the eye and then and then tell the patient to look up. That would be isolating just the superior rectus muscle, all right? You can do something very similar whenever you get to the inferior oblique, right? So again, this is testing the eye to look up. So what we need to do is we need to take the eye's gaze and we need to shift it to be more parallel with the inferior oblique, right? Well, in this case, the inferior oblique is running this direction, right? Oops. It is running in, this is not working, hold on. It is running in this direction here. Sorry about that. So it's running in that direction. So what we need to do is we need to rotate the eye this way to be more in a line. So then the eye's gaze would be a bit more aligned, and it would be something like this, right? It would be looking kind of out this way, kind of toward the medial side of our orbit, like you're looking towards your nose, okay? And then once you do this, you would instruct the patient to look up. So in this case, you would have to adduct the eye and tell them to look up. So the first one was abduct, you're turning away, you're looking out. Second one, for the inferior oblique, you're looking in. You're causing them to look in and then instructing the patient to look up, right? When we go to the other side, we see the same thing, right? So if we move to this other side and we redraw our planes here, right, we're going to do one in green for our superior oblique, right? So our superior oblique is in this plane here, right? And then if we go to our inferior rectus, it is going to be in this plane here, right? It's going to be pulling back that way, right? So you follow the same principle, right? So again, this is the orientation or the plane of our gaze of our pupil looking straight out. So if we want to isolate just the superior oblique, what we need to do is shift that gaze to be more in a line. So we need to shift it this way here so that that gaze is now looking out this way, right? It's looking more toward the medial side of the face, so looking more toward the nose. And then in this case, you would instruct the patient to then look down because the superior oblique and inferior rectus muscles are causing you to look down, all right? You do the same thing for the other side. I'm sorry, for the other muscle, which is your inferior rectus, right? So in this case, we need to turn our eye slightly outward, right? We need to shift slightly out this way a little bit. So then our plane is going to be here, right? So slightly more abducted, and that's more parallel, right? I didn't draw the line exactly parallel, but it's more parallel to the inferior rectus muscle. And then you would do the same thing. You would instruct the patient to then look down, and you know that you would then be isolating just the inferior rectus muscle and not testing the superior oblique, okay? So those are the slightly more difficult muscles to isolate, just because you have to understand a little bit more, and you have to instruct the patient to look out and then up, or look in and then up, or down. And so there's a few more steps, right? So if we go down now, if we come down here, we can look at our other muscles. And so the other two that we have not discussed are going to be our two other rectus muscles. And these are going to be our medial rectus and our lateral rectus, right? So our medial is going to be here and here, and our lateral rectus is going to be here and here, all right? These two muscles, medial and lateral rectus, these are the only muscles that act in the x-axis, right, or in a horizontal plane, right? So in other words, if we were to draw their plane, they are acting in this horizontal x-axis just like this. Same thing on this other side, they're acting in that plane there, right? So when the medial rectus muscle contracts, it's going to cause the eye to look directly in. It is going to adduct the eye, pull it in, right? So take the medial rectus here, it contracts, it's going to cause the eye to look this direction. You take this other medial rectus here on the left side, contract it, it's going to cause the eye to look in that direction as well, all right? You go to the lateral rectus muscles, And so we go here, contract it out. It's going to cause the eye to look out that way. And then we take the lateral rectus on this side, contract it, causes the eye to look out that way. So those are causing abduction of the eye, okay? So those are the two that are relatively straightforward, right? And you can test all of this with the H test, right? And so the H test, you move your hand up, and then you move it down, then you move it to the left and to the right, back and forth, and then you move it up and down again, and you make somewhat of an H. And as you're doing so, you're following the patient's eyes, and you instruct the patient just to follow your finger with just their eyes. Don't move your head, but just move your eyes left, right, up, and down. And you can also move it kind of at angles, so you can kind of move it out this way if you need to. You can move it down out this way as well to test those, to test some of those other muscles. And all the while you're doing this, you're checking their gaze, you're checking their eyes, you're checking to see how smooth their eyes are when they track you. Do they have any nystagmus? Are they having difficulties following you in a particular direction, which could indicate some type of nerve damage, nerve lesion to one or more of the cranial nerves that innervate the eye. So remember, just as a review, our cranial nerves that innervate our eyes, we're going to have the lateral rectus is going to be innervated by cranial nerve 6. Our superior oblique is going to be innervated by cranial nerve 4. And then the rest of them, are going to be cranial nerve 3. So there's a mnemonic here, LR6, SO4, R3. That's the mnemonic. Lateral rectus is the trochlear nerve. The abducens nerve. Superior oblique is the trochlear. And then the rest of them, so those other 3 rectus muscles and then the inferior oblique, are going to be cranial nerve 3, which is the oculomotor nerve. All right. So this wraps up our extrinsic eye videos testing the function of each of these eyes. So again, think of where the muscles are. Think of how they attach to the eye. Again, for the superior rectus and inferior oblique, and superior oblique and inferior rectus, remember you have to do a little bit more work to kind of understand how those can be isolated when you're testing them. But go through these medial and lateral rectus muscles, and you will have it down.